Hello everyone. Today we'll be talking about mastication and deglutition. So let's begin. Let's begin talking about mastication. In layman's term, it is known as chewing. It's a process by which food is taken into the mouth. Okay, since the large morsels are taken, they are broken down into smaller pieces. Okay, this food mixes with the secretions of salivary gland or mixes with the saliva. Okay, now this complex function requires involvement of muscles known as muscles of mastication, teeth, periodontal structures, supportive structure, temporomandibular joint, jaw, lips, tongue, cheek, palate, and salivary gland. Alright, now let's talk about mastication in detail. Now let's understand why mastication is important. First thing is large food particles are broken down into small ones, okay? Fine particles. So it aids in digestion. The morsels become softer because they are mixed with saliva. Okay, so this helps in digestion. Other than that, there are some vegetables which are covered by cellulose and hemicellulose, which are indigestible in human gastrointestinal system. Okay, so chewing breaks them into cellulose substance which becomes digestible. Okay, now let's understand the mechanism behind the chewing of food, okay, or behind the mastication. So talking about the mechanism, first is initiation of chewing or the chewing starts. Now this is a voluntary process. Okay, although the whole act of chewing is often reflex in nature, so as soon as the food enters the mouth, your body automatically knows that you have to chew, correct? So the act of chewing is mostly due to movements of the lower jaw. Okay, the types of movement are nothing but opening the jaw, closing the jaw, and sideways movement of the jaw. All right, and this movement of the jaw is possible because of the masticatory muscles or muscles of mastication. Okay, and they are said to be the strongest muscles of the body. Now let's understand the mechanism in detail. So let's understand how chewing takes place. Correct? As soon as the food enters into the mouth, there is movement of lower jaw which occurs. Right? Now this movement is opening, closing, and sideways movement. Correct? This movement is possible because of muscles of mastication. They are said to be the strongest muscles of the body which helps in chewing the food. Correct? So main muscles of mastication are masseter muscle, temporal, then medial pterygoid and lateral pterygoid muscles. Correct? Other than that, there are accessory muscles of mastication divided into two, suprahyoid muscles and infrahyoid muscles. So suprahyoid muscles are digastric, stylohyoid, mylohyoid and genohyoid muscles. Alright. Infrahyoid muscles are sternohyoid muscle, thyroid muscle and homohyoid muscles. We have already spoken about muscles of mastication in another video, so we won't be talking about them in detail in this video. Alright. Now let's talk about the forces of mastication. Maximum bite force in female is 70 to 99 pounds and in males it's 118 to 142 pounds. Alright, maximum bite force of molar is 91 to 198 pounds and central incisor is 29 to 51 pounds. Alright, now let's go ahead. Now let's understand the chewing cycle. Alright, first is opening phase, followed by closing phase and occlusal phase. Alright, chewing sequence can be divided into preparatory series, reduction series and pre-swallow series. Now let's understand the chewing cycle. Alright, the functional movement in chewing cycle is during chewing, the mandible drops directly inferiorly until the desired opening is achieved. Okay, so as soon as you put the bolus inside, the mouth is slightly open. Correct, or the mouth is open until the desired opening is achieved. Alright, once the bolus is placed between two opposing sides of teeth, right, then it shifts to the side on which bolus is placed and rises. Okay, as it approaches maximal intercuspation, bolus is broken between opposing teeth. Okay, and in the final closure, the mandible quickly shifts back into intercuspal position. Alright, now let's talk about the opening phase in detail. Coming to the opening phase, now here we'll talk about the muscles in detail. Alright, in this cycle we understood that as soon as you open the mouth, you place a bolus inside, correct? The mouth is open till the desired point, correct? Once the bolus is placed in between two opposing teeth, the mouth closes, correct, achieving its maximum intercuspation, because of which the bolus is chewed, okay, or breaks into smaller particles, correct, and once that is done, the mandible comes back to its normal intercuspal position. Now talking about the opening phase in detail, here the muscles which actively begins in the ipsilateral inferior head of lateral pterygoid muscle approximately halfway through the period of tooth contact. Alright, followed closely by the action of contralateral inferior lateral pterygoid muscle. Both superior and inferior head of lateral pterygoid muscles are active during opening phase. Okay, in early opening phase, even digastric muscle is active. Alright, and remain active until maximum opening position. During the opening phase, the muscles which remain inactive are masseter, temporalis, medial pterygoid. Alright, now to tell you this in very short form, it's that once the muscle activity begins, the first muscle which becomes active is the inferior head of the lateral pterygoid, same side on which you have placed the bolus. Okay, followed by the inferior head of lateral pterygoid muscle on the opposite side, okay, of which the bolus is placed. So once both the superior and inferior head of lateral pterygoid muscles also become active, in the early phase of opening phase, even the digastric muscle is active. So that's all about the opening phase you need to know. Alright, so which three muscles? The superior and inferior head of lateral pterygoid muscle and digastric muscles are active. Alright, now let's talk about the closing phase. Coming to the closing phase, an initiation of jaw closing, the inferior head of lateral pterygoid muscles ceases their functioning and activity. Alright, during early closing, contralateral medial pterygoid muscle becomes more active in wider stroke, stops the activity during intercuspal phase. Contralateral medial pterygoid controls the upward and lateral positions of the mandible. The ipsilateral and contralateral medial pterygoid muscles are active on the onset of intercuspation when chewing strokes are narrow. Activity increases in the anterior and posterior temporalis muscle and deep and superficial masseter muscle. Alright, and activity declines on the onset of intercuspation. Now let's begin talking about the occlusal phase. So in vertical effort, that is clenching in centric occlusion, most of the elevatory muscles are active, okay, at their maximum level. In some subjects, the medial pterygoid muscle activity is low. The inferior head of lateral pterygoid produces little activity or only 25% of maximum activity when compared to superficial head. Okay, muscle activity decreases when less posterior teeth are present and only when the incisor contact is there. So in the digastric muscle is slightly active during vertical effort with intercuspal clenching, but more active during vertical incisive clenching. Okay, the cycle of opening and closing the jaw leads to mastication. Tongue contributes to the grinding process by positioning the food between the upper and lower teeth. So that's all about the chewing cycle you should be knowing. Let's begin with the importance of saliva in mastication. Saliva moistens the foodstuff, holds them together with mucus which is thick and slippery. Alright. Parotid gland contributes 20% of total saliva in humans, submandibular 70%, sublingual are 5%, and other remaining 5% are by minor salivary glands present in the oral cavity. Okay, edentulous patients are often restricted to soft diet because of loss of teeth. Okay, and they have difficulty in eating dry food. Let's understand mastication difficulties are seen in which patients. One, which have persistent orofacial pain, patients with myalgia, fibromyalgia, temporomandibular joint disorders, Parkinson's disease and Bell's palsy patients often have difficulty in chewing food. Now that we have already spoken about chewing, mastication or chewing cycle, now we have to talk about the next thing. What happens after you chew the food? Obviously, you swallow the food, correct? Now, swallowing is a very complicated mechanism. Why? Because there is pharynx, correct? Now, pharynx serves not only respiratory system but also assist in swallowing. The pharynx is converted for only a few seconds at a time into a tract for propulsion or for swallowing the food. Okay, and it is especially important that the respiration is not compromised during those few seconds. Alright, and it involves coordination of activity of tongue, soft palate, pharynx, esophagus and 22 separate muscle groups. Alright. The decision of swallowing generally depends on the degree of fineness of the food or how fine your food is chewed or how small the particles are formed, the intensity of taste extracted and the degree of lubrication of the bolus. Alright, when the bolus is soft, it's very easy to swallow it. Okay, now there are two types of swallowing. One is somatic or mature swallow that is seen in adults, and the other one is a visceral or infantile swallow which is seen in infants. Now let's talk about this swallowing mechanism in detail. Now let's begin talking about the visceral or infantile swallow. It is seen in infants and has following characteristics. The jaws are apart, okay, with the tongue between the gum pads. Mandible is stabilized mainly by contraction of muscles innervated by 7th cranial nerve, okay, and the interposed tongue. The swallow is guided and to a greater extent controlled by sensory interchange between lips and tongue. Now let's talk about the somatic swallow. We all understood that the infantile swallow was basically for sucking and drinking the milk, correct? The somatic swallow begins after the 18 months of age or by 18 months of age, okay, and it has following characteristic. First, it's the teeth are together. Second is the mandible is stabilized by the mandibular elevators, okay, that those are the muscles which elevate the mandible, okay, and they are innervated by trigeminal nerve. Third thing is the tip of the tongue is held against the palate, okay, above and behind the incisors. And then there are limited contractions of lip during mature swallow, which is quite opposite of the infantile swallow. Alright. Now in normal growing child, as the posterior teeth erupt, the occlusion of teeth takes place, correct, and the transition to adult swallow occurs. Now in case of presence of any malocclusion because of developmental deformity in the jaw or early loss of teeth, okay, or when the teeth fail to erupt, the infantile swallow is maintained or resumed. Alright, now swallowing has three stages. First is a voluntary stage where the swallowing process is initiated or started. Second is a pharyngeal state. Now this is an involuntary stage. Okay, it constitutes of passage of food through pharynx into the esophagus. And the third is esophageal stage. Now here again an involuntary phase that transports food from pharynx to the stomach. Okay, now let's understand each stage in detail. Now let's begin with the voluntary stage. First, oral phase or the first stage of swallowing is a voluntary phase. So when food is ready for swallowing, it is voluntarily squeezed or rolled posterior into the pharynx by pressure of tongue upwards and backwards against the palate. Okay, now that's the voluntary stage which has occurred. So once the food is ready to be swallowed, it is basically squeezed and rolled posterior into the pharynx by the pressure of tongue. The pressure is applied upwards and backwards against the palate. Got it? Now let's talk about the pharyngeal stage in detail. Let's begin with the pharyngeal stage. Okay, now this is the second stage of swallowing and this is an involuntary phase. The entire process of pharyngeal phase only takes 1 to 2 seconds. Alright, now what basically happens is when your food is ready to be swallowed, alright, the deglutition center which is present in the medulla oblongata and lower pons coordinates the reflex activity. Okay, so the pharyngeal phase of swallowing is a reflex that is initiated by stimulation of tactile receptors in the area of oropharynx. Alright, now what happens here? The efferent impulses travel through sensory portions of trigeminal nerve and glossopharyngeal nerves into the swallowing centers in the medulla oblongata, that the food is ready to be swallowed. So the medulla oblongata initiates motor stimuli in response to the efferent impulses, okay, which again pass through the trigeminal nerve and glossopharyngeal nerve. Other than that, the vagus and accessory nerves also are involved, okay, because in this soft palate and pharynx both are involved. Understood? So now how the events takes place? Basically the oral cavity is shut, okay, now the food is ready to be swallowed. So the oral cavity is shut off from the pharynx by approximation of posterior pillars of fossae, okay. Then the nasopharynx is closed by the upward movement of soft palate so that the food doesn't enter your nasal cavities. Okay, the palatopharyngeal folds are pulled immediately to make a slit like opening for food, okay, so that it passes through the food pipe and doesn't go and enter the windpipe, okay, and the food can pass easily. The vocal cords strongly approximate stopping the breathing temporarily. Okay, so the whole process takes 1 to 2 seconds during which your breathing is stopped. So larynx is pulled upwards and anterior by neck muscles, enlarging the opening of esophagus, which is normally a slit, and epiglottis swings backwards to close the laryngeal opening. Okay, so all this guides the food towards the esophagus and prevents its entry into the trachea. Alright, now the upper esophageal splinter, which normally remains contracted, tonically opens up. Okay, so it allows the bolus of food to be pushed into the upper part of esophagus by the rapid peristaltic contraction wave of pharynx. Okay, which also continues into the esophagus. So once the bolus of food is passed through esophagus, okay, the cricopharyngeus contracts, vocal cords open up, allowing normal breathing to be resumed. Alright, so that's how your food enters or passes from pharynx into the esophagus, and this completes the second stage. Now we'll move towards the esophageal stage or the third stage of swallowing. Now let's start with esophageal stage. Okay, now this is the third phase and it is again involuntary. Basically, passage of food from the esophagus into the stomach takes place in this phase. Alright, and it is aided by gravity, and there is esophageal peristalsis which helps in passing of food from the upper part of esophagus into the stomach. Okay, and the whole phase takes about 5 to 8 seconds to get completed. Alright, now see, esophagus is basically a fibromuscular tube about 25 centimeter long. Okay, now this tube has two splinters or two gates. Okay, one is a upper esophageal splinter. that normally contracts tonically and serves to prevent entry of air into esophagus during normal respiration. Okay, and during the process of swallowing the food, when there is rapid peristaltic wave which passes, this splinter opens up, okay, so that the food passes from pharynx into the esophagus. All right, now the lower esophageal splinter, basically it's a door, okay, from the lower part of esophagus and stomach, in between the lower part of esophagus and stomach. Now basically what it does is, when the food enters the stomach, it prevents its regurgitation or backward flow of the stomach contents into the esophagus. Alright, now talking about peristalsis. Now it's a wave like muscular contraction. Okay, it produced by a series of localized reflexes in response to distension of wall by bolus. Okay, so these steps occur in each peristalsis movement. Once the bolus enters into the esophagus, which is a circular smooth muscle, contracts behind, okay, and relax in front of the bolus. So the bolus starts to pass through this tube. Okay, it is followed by longitudinal contraction of smooth muscle, and the rate of peristalsis is 2 to 4 cm per second. Okay, the esophagus normally exhibits two types of peristaltic movement: primary and secondary. Alright, now let's talk about the primary peristalsis movement and secondary peristalsis movement in detail. Coming to the primary peristalsis. Now here what happens when primary esophageal peristalsis is initiated by swallowing. As soon as the food enters the esophagus from pharynx, the upper esophageal splinter contracts. Okay, now this prevents regurgitation of food into the mouth. Okay, and the primary esophageal peristalsis begins as the food is pushed or propels downwards, okay, going towards the stomach. Now the lower esophageal splinter relaxes as the peristaltic wave approaches in the splinter, so that it allows the food to pass from the esophagus into the stomach without causing any resistance. Alright, now talking about the secondary peristalsis. Secondary peristaltic wave is a result from distension of esophagus itself by the retained food. Alright, so sometimes what happens, the food is retained in the esophagus, it doesn't go down as quickly as it should be. Okay, so this wave continue to, okay, the peristaltic wave, the muscular contraction keeps coming until the food is entered into the stomach. Okay, so when the primary esophageal peristalsis is not able to push a bolus or solid food all the way down into the esophagus, the food remaining in the esophagus stretches and mechanical receptors initiates another peristaltic wave known as secondary esophageal peristalsis. Okay, so this secondary esophageal peristalsis is coordinated by the intrinsic nervous system of the esophagus. Okay, so that the bolus of the food easily passes into the stomach without any resistance. Okay, so this is all about the secondary peristalsis you should know. So to conclude, in the mastication, okay, we have learned about the importance of mastication, how chewing cycle occurs. Alright, in the swallowing we have spoken about the stages of swallowing, how swallowing occurs, how it is different in infants as well as in adults. Alright, so if you have any doubts, you can just comment below. Thank you. Like, share and subscribe, and please leave a comment. Thank you.